May I call upon the next speaker, Dr. Ankita Singh.
Good morning, everyone. My topic is on posterior keratometry changes after steep axis phacoemulsification. So presently, it is a generation of a refractive cataract surgery where everybody wants emetropia. In our study, we have tried to find out the influence of the posterior corneal astigmatism on total corneal astigmatism, because so far, due to the primitive devices which were existing earlier, only the effect of anterior keratometry was taken into the consideration while calculating the surgical induced astigmatism. So the study was done at a tertiary care eye hospital, and it included the 60 eyes of the consecutive patient with age-related cataract, and they all underwent uneventful phacoemulsification surgery at the same institute. The inclusion criteria included the patients with age-related cataract, regular astigmatism by topography, and no existing preocular pathology. The exclusion criteria included any cataract other than the age-related, any history of trauma, contact lens wear, corneal scars, or any opacification which would have affected the visual outcome. The patients underwent the complete ocular examination, and the keratometry was evaluated on the anterior as well as focal posterior corneal surface at 3 mm, 5 mm, and 7 mm respectively. And the parameters subsequently were used to guide the steep axis emulsification. Then later on, the anterior and posterior corneal astigmatism, they were defined as per with the rule, against the rule, and oblique based on the steep corneal curvature. Post-operatively, the patients were followed up, and after 1 month, the data was taken into consideration. So these were the results. Out of the 60 patients, mostly the average age was 60 plus, and mostly male patients were there. And out of them, 39, that means 65% patient had pre-existing against the rule astigmatism. The overall result which we saw was there was no significant decrease in the anterior corneal keratometry, whereas there was a decrease in the anterior corneal astigmatism. Whereas when we saw the posterior corneal curvature, at the focal points 3 mm, 5 mm, 7 mm, there was a decrease in the keratometry values. However, there was an increase in astigmatism. So, as per the conventional practices, only the anterior corneal astigmatism was corrected, but by the Steinfluck imaging system, now we can take into the consideration of the posterior corneal curvature also. And the studies have already been started publishing, which have shown that has been an effect, and there has been focal steepening because of the effect of the emulsification on the posterior corneal surfaces. Now, this was a single follow-up study, and there was a small population, so this has its own limitation. Probably a long-term follow-up study will be required to conclude the concrete data. So based on the result of our study, we can conclude that the steep axis may have a larger impact on the posterior corneal surface than it was actually thought. And it may clinically impact the more precise manner of post-operative cataract surgery planning and astigmatism correction. These are my references. Thank you.
What is the period of follow-up till now for this study?
Ma'am, this was 1 month, ma'am.
1 month.
1 month.
So it's too short, I think.
Yes, ma'am, it was too.
Regression will start after 3 months.
So.
Anyway, there is called on-axis phacoemulsification. The term is not steep axis phacoemulsification. It's called on-axis phacoemulsification.
So.
Anyway, have you quantified your incisional size?
Sir, it was 2.8 mm and it was biplanar, sir.
Have you quantified
Yes, sir.
on that incision planning the incisional size, because according to the astigmatism, preoperative astigmatism you have found, because it has got a very important role. You cannot make only a standardized incision for all sorts, all grades of astigmatism. Higher the length, longer the incision, more is the flattening, is not it? More anterior is the incision, more is the flattening. These certain rules are there.
So.
Have you gone for that?
So far we have not done that, sir, but yes, sir, it should be taken into consideration.
Okay.
How many surgeons were involved?
Only one surgeon. The same surgeon, we have followed the data of the same surgeon, sir.